A year ago, we took Jack to his regular vet, general veterinarian, and he was having a lot of teeth issues, mouth issues, and his breath started getting bad. So took him to the vet, and she said he had two teeth laying down, but they're ready to fall out. And we went through I don't know how many months of different antibiotics, and still not getting better. So I called the vet in Lebanon, Maine. We live in New Hampshire, but their vet recommended mainly veterinarian here in Wyndham. And so I called and they took Jack in right away. They even actually took him in 2 weeks earlier than what his appointment was. They asked me to send pictures and they said, yeah, bring him in. And that same day, I mean, when Dr. Keaten came in, Jack just loved her right away. She got on the floor with him. Like, you knew this woman loved her client, her dogs.
Jack was in so much pain, we decided to do something immediately. We got Jack under anesthesia and we did his CT and oral exam and found that on his lower jaw, so the right mandible, the bone was exposed, about half of the jaw. The bone was exposed, a lot of discharge and some really rotten teeth. And so we got a biopsy to confirm the diagnosis, but based on his oral exam, we suspected necrotizing osteomyelitis, and the biopsy confirmed those findings. So this is a condition that can happen for many different reasons, oftentimes unknown causes. Here at Mainely Veterinary Dentistry, we only do dentistry work, and so we're up to date on the research and the articles that come out, all the time. We're reading those, and we are very familiar with all the conditions that can happen in the oral cavity of cats and dogs. And so, the general practitioners out there are doing their best, and they often can do, a lot of the simple dentistry, but when it comes to something like this, we're very knowledgeable when it comes to dentistry. He's feeling a lot better, but we still have a little bit more work to do. Now that he's been on antibiotics for a month, we're gonna go back in and see what bone has declared itself as healthy and what bone has declared itself as dead, and do our hopefully final debridement today, extract a few more teeth, and get Jack back on the road to feeling better.
And it's been a night and day difference, absolutely night and day difference from his first surgery. She got him on the right antibiotics, the right medication, like everything went perfect. And he's back to his old self.
I don't know what Jack would have done without it. So we're extremely grateful. And
yeah,
I wouldn't go anywhere else. It's an hour and a half drive for us,
yep,
but it's worth every mile. It's worth every minute, because this is Jack's new dentistry vet, and this is where he's going to come. And we're scheduling him for regular cleanings and dental care, because we found not taking care of the dental stuff can lead to some serious problems. And Jack got really sick, and we're concerned about what would have happened if we hadn't found Dr. Keaten, and she straightened him out. She got him.
She did.
She saved Jack.
She really did.
He's a whole different. He's back to who he was, and it's all thanks to her. She did a great job with him.
And all the staff, the whole team,
the whole staff
been wonderful.
Very friendly,
even
very helpful.
The girl at the front desk.
The reception. They're all wonderful.
Everybody's wonderful here.